A round of applause for our Principal Secretary. Karibu sir.
Thank you, Beverly. The CS for Interior and National Administration, Professor Kithure Kindiki. The CS for Health, Dr. Baraza Deborah. My PS colleague, Harry Kimtai, PS in charge of medical services. The chairperson of the President's Council of Economic Affairs, Professor Ndi. The deputy government spokesperson, Mwanaisha. The DG in charge of medical services, I think, yes, the Director General for Health, Dr. Moth. The CEO for Social Health Authority. Colleagues, ladies and gentlemen, good morning. Good morning once again. Now, I first of all must admit that I am excited when I look at the color in the room and the uniform and the faces and the energy. And the fact that we've been able to stop everything within the national government administration at the sub-county level to come and have a conversation with our colleagues at the Ministry of Health as we plan the rollout of a very important program for the administration of President Ruto. Now, a week or so ago, we were having a conversation with the Ministry of Health and the relevant stakeholders and senior officers in government. And it became apparent that we were only having a few days to the official rollout of the Universal Healthcare Coverage Program, which is to begin on Tuesday next week. And there has been a lot of engagements, there's been a lot of interactions, there's been a lot of training, particularly within the Ministry of Health, all the way down to the community health promoters. And I know that even this week there is an ongoing engagement that is being undertaken. But then we realize that there is a critical component and a critical cadre of national government administration officers that were missing in that conversation and that engagement. And because of one of the greatest responsibility that this cadre of officers have in government, which is in terms of coordination of government programs and activities across the country, we were guided by His Excellency the President that we convene so that then we are taken through some of the critical components of this Universal Health Coverage Program. So today's program is going to be very elaborate, but at the same time, very specific in terms of what is expected of all of you and all of us. So if you look at your program, you will notice that we have split the program into two sessions. So the first session would be to get remarks from our two cabinet secretaries, followed by a presentation by Professor Ndi, just to put things into context. Why universal health coverage? Why now? And how does it link with the government priorities as captured in the plan? Then we'll have a short health break. After that, we will go into the detailed presentations. First, beginning with the framework for the rollout plan, and also what we are expected to do in the entire rollout program and the implementation of the program. And then subsequently, then we'll look at the benefits, the benefit package, how the different packages have been profiled. And then, of course, lastly, we will look at what the targets are and the reporting structure. as we are here this morning, the enrollment is going on, and it will be good to know how far or how well we are doing so far with the enrollment, and what we must do between now and the 1st of October when the actual rollout begins, and what must happen going forward beyond the 1st of October. Also, to just put things into perspective, we have 8 regions administratively within the national government administration structure. The RCs had been introduced, but 2 of the regional commissioners walked in as we were finishing that process. The regional commissioner for Western, Mr. Irungu Masharia, thank you, and the regional commissioner for Nyanza, Madam Flora Moroa. We have 47 counties. For today, the county commissioners are not with us, but they will benefit from the discussions that we'll be having because they are part of the reporting mechanism. And then we have a total of 389 deputy county commissioners spread across in each of the regions and the 47 counties. And below the deputy county commissioners, we have the assistant county commissioners. And then below the assistant county commissioners, you have the chiefs, who are in close to 1,000 locations, and the assistant chiefs in 3,999 sub-locations. And below the assistant chiefs, who are at the sub-locations, you have the village elders, and we have in excess of 106,000 villages. And this marries closely with a close to, 107,000 community health promoters spread across the country. So you can already see that there's a very good nexus and a very good opportunity to be able to have a perfect and seamless linkage with our CHPs for purposes of us undertaking and rolling out this program. With those few remarks, allow me to invite the Cabinet Secretary responsible for Interior and National Administration to make his remarks, and then he will invite the CS for Health. Thank you.
Thank you, PS Raymond. My sister CS Deborah, the PSs who are here, Raymond and Harry, the chairperson of the President's Council of Economic Advisors, my brother David, all the senior officials from the Ministry of Interior, Ministry of Health,